It's cold and flu season here in the town of Barnstable as well as Cape Cod. Lots of different things going around out there. With me today, the Barnstable County nurse and Deirdre Arvidsson. You're joining us today to kind of talk about what's out there for resources for folks that either still need a flu shot, which I highly recommend, or some of the other resources that the county nurse does provide. So let's start with a little bit about you and what you do at the county.
Okay, well, I've been a nurse for about 27 years, and I've been in this position as the county public health nurse for the last 9 years. And one of our programs that we offer is a public immunization program right in my office, 2 days a week. Right now it's currently Tuesday and Wednesdays by appointment, so just call, make an appointment, we'll get you in. And we do every adult recommended vaccine, some of the children's vaccines, and travel vaccines too, including Japanese encephalitis. We will have yellow fever back, hopefully in June, but people can still get a flu shot. It's important to get a flu shot to help prevent the flu. Even if you get the flu with the flu shot, it's probably not going to be as severe. Okay, and we provide them still. We have plenty of flu vaccine. Also, if you're 65 or older, you want to get the pneumonia shots.
Right.
There's 2 of them right now, the Prevnar 13 and the Pneumovax 23. You want to make sure you've had both of them. You can get them, if you've never had any, get the Prevnar 13 first, and then a year later, get the Pneumovax 23. Okay. That's the ideal way.
That's really important. And talking about flu a little bit, there's so many viruses, bacterial or viral, that just kind of like appear here on the Cape. There's been an upper respiratory one going. Let's talk a little bit about the difference of flu and everything else Cape Cod creeping crud out there.
Okay, so the CDC puts out a great brochure. It's called Get Smart. Okay. You can look at it online too, cold or flu. Antibiotics don't work for you.
Okay.
So it basically tells you a little bit about how do I know if I have a viral or bacterial infection. Because colds are caused by viruses in general, and and an antibiotic will do nothing for a virus. It won't cut it short, it won't prevent you from giving it to somebody else, and it just won't make you feel better any sooner. And that's a total misconception that some people do have.
And bacterial, so the viral just runs its course, right?
Yeah.
3 to 7, 10 days kind of thing. And
Yeah.
bacterial is where you would get an antibiotic?
Right, it could be. It
Okay.
could be. You want to, usually when there's a bacterial infection, you have a fever. That's
Okay.
not uncommon. The other thing I wanted to mention is some people say the mucus that you get from your nose or cough up from clear to yellow or green, does that mean you need an antibiotic? Because sometimes people think that. And that's not true either. Yellow or green mucus does not mean that you have a bacterial infection. Okay. It's normal to change color and get thicker, so it's not. It can be used to treat antibiotics for strep throat.
Okay.
Sometimes, yep, because you don't want to get, scarlet fever from that. So sometimes, you really have to go to your provider and get an examination. Just because you're uncomfortable, stuffy, and feeling miserable does not mean you need antibiotics. Sometimes a sinus infection sometimes will warrant antibiotic use.
Right. And then the flu, I've always heard that when you get the flu, it comes on like a Mack truck.
Correct. That's usually the case. It comes on suddenly. And the key there is that as soon as you feel like you have the flu, if you weren't sick and then you're incredibly sick, go get a flu test so that you can be part of those statistics, and also so that you can get on an antiviral right away, because that's important to get it within the first few days to hopefully reduce the course. It's not going to make it go away right away, but it will hopefully reduce the course and severity of your flu.
Right. And there's some other programs that you're out there in the community with. We were talking pre-interview. I hadn't realized this, but a lot of the food pantries have nurse services now. Well, your nurses are there. Tell us a little bit about that program. I thought that was fascinating.
Okay, well, I started a program around 2011 called Ask a Public Health Nurse. And it started in one pantry, and I brought health literature, health resources. I did free blood pressure screening and offered free flu shots to clients and staff during the season. And that has grown. That has grown to we are in almost all food pantries, especially the larger ones from Bourne to Provincetown, and a couple soup kitchens and the baby center. Usually a couple times a month we offer. Our nurses are great because you can come up and ask them questions, you know, that you wouldn't have time to in a doctor's office.
Right.
Okay, and we have resources that are available to them. Public health nurses do a lot of education out in the community, and that's what we do. We also collaborated with Falmouth Service Center, who initially had a grant to fund what they called Foods to Encourage program, which some of the pantries are choosing to do. And that's a little more structured. It's for clients who have hypertension, diabetes, or pre-diabetes, and they can come on a weekly basis to have their numbers checked. And in exchange for that, they receive an extra bag of produce, free bag of produce. They receive medical or nursing education, one little piece, and there's also a nutritionist on hand to answer any nutrition questions, especially regarding how to prepare the produce that they're given. Usually there's a sample involved, and that has been a really successful program.
And successful by means that people who are educated about their chronic illnesses tend to, number one, manage them better and maybe kind of alleviate some of the chronic things that happen with those illnesses as well, right?
Absolutely. We've seen blood pressures come down. We've seen a reduction in blood sugars. In some of these locations, we've also found people who did not know they had diabetes. From just coming to our program, and we were able to hook them up with a primary care doctor to manage their illness. And yes, what happens is if you have a chronic illness and are able to check in with somebody more frequently, it does help to keep any kind of exacerbations of that illness down and potentially keep you out of the hospital or the emergency room.
Right. And you talked a lot about all the immunizations available through your office. Flu season still here, going to be here till March, but you told me that flu vaccine is good for a year?
Yeah, every year you're supposed to get a new flu vaccine, basically, because what happens is the Centers for Disease Control have surveillance all over the world, really, and in the World Health Organization Sentinel sites to determine which are the most commonly circulating flu viruses. And that's what they base the next year's configuration of viruses on the flu shot. So, and we also do all adult recommended vaccines. Adults are recommended more vaccines today than they ever were.
Right.
So that's important to stay immunized. There's so many illnesses out there that there are not even vaccines for. So it's important that to take advantage of the vaccines that we have.
Right. So they can call your office?
Absolutely.
Do you have a number that they can call?
508-375-6617.
Great, and they can always go to the county website and see information for you there as well.
Absolutely.
Thank you so much. This was very informative, and let's hope that we all stay healthy.
I hope so too. Thank you
Thank
very
you.
much.